Everybody see that?
Yes.
Good. Okay, so how is the brain protected? Well, obviously it's protected by the skull, but there are linings that cover the brain, and these linings are called meninges. They cover and protect the central nervous system. They protect the blood vessels and enclose all of the sinuses of the venous blood that goes to the brain. And the meninges contain cerebrospinal fluid. And the meninges form partitions in the skull. There are 3 layers of meninges, and I certainly want you to know them. From external to internal. The outer layer is the dura mater, okay? Dura means tough, mater means mother. So it's a tough mother. The arachnoid mater is the middle layer. Arachnoid is spider-like. And pia is small, pea-sized. So outer layer is the dura, inner layer is the arachnoid, and the middle layer is the arachnoid, and inner layer is the pia mater. Those are the 3 layers of the meninges. And you can kind of see it here. Here's the dura mater, here's the arachnoid mater, and here's the pia mater. So the pia mater actually touches the brain. Okay? So that's important. There's also another important space in here, and this is called the subarachnoid space. That space is just what it says. It is below the arachnoid mater. It's between the arachnoid mater and the pia mater. The reason the subarachnoid space is so important is because that's where the spinal fluid is. Okay, when you have a spinal tap, if say you have a brain disease and we're worried about you having meningitis or encephalitis, we need to do a spinal tap. And we put the needle into your spinal cord and we go through the dura, we go through the arachnoid, and in between the arachnoid mater and the pia mater is the subarachnoid space. And that's where the spinal fluid is. Okay? And we look for normal spinal fluid. And normal spinal fluid is clear just like water. Just like water. If it's cloudy, that means you have an infection or another problem in your brain. So the dura is the strongest. It is basically fibrous connective tissue. And that's really all you have to know about the dura. It's the outer layer and the strongest layer, and is made up of fibrous connective tissue. And it protects the brain. It's between the skull and the brain. You don't have to know these other things. That's not important. I just want you to know the 3 layers and the subarachnoid space. The arachnoid mater. The arachnoid mater is the middle layer. And like I said before, the word arachnoid means spider-like. So there are spider web extensions that poke out of the arachnoid mater. And right below it is the subarachnoid space. And here it is. It contains cerebrospinal fluid. It contains cerebrospinal fluid. Okay? Now there's a space underneath the dura called the subdural space. And that subdural space is where if you are hit in the head or you fall down on your head, you can bleed. And that bleeding is because of the blood vessels, the veins that supply the dura with blood. And then you have bleeding in between the dura and the arachnoid in the subdural space, and it pushes on the brain itself. In the arachnoid mata are the arachnoid granulations, and these are important because if the spinal fluid is made in the choroid plexus, it is reabsorbed in the arachnoid granulations. That's where spinal fluid is reabsorbed, and it's reabsorbed back into the venous blood. Okay? The pia. The pia is the thinnest, delicate membrane that touches the brain. It is the inner layer. It is the inner layer of the three meninges: dura, arachnoid, and pia mater. Know them. Okay? What is meningitis? Well, meningitis is an inflammation of the membranes of the meninges. If you have inflammation of the brain, it is called encephalitis. So encephalitis is inflammation of the brain, where meningitis is inflammation of the meninges. Two different infections. But the way to diagnose meningitis is to do a spinal tap. You put the needle into the spinal cord, into the subarachnoid space, and you collect spinal fluid for examination. Okay? Cerebral spinal fluid. Cerebral spinal fluid is made in the choroid plexus. It's made in the choroid plexus, and it cushions the brain. It actually is a cushion. It is a watery solution, and it has in it glucose and protein, but basically it's water. It's water. So your brain actually floats in water. Actually floats in water inside of the skull. Okay? The choroid plexus, a cluster of capillaries that produces the spinal fluid. It produces the spinal fluid. And remember, cells that produce spinal fluid are called ependymal cells, and these line the cavities, and they have cilia on them so that the spinal fluid can move around. Okay? So that's important to understand. Here is the spinal fluid. All this in blue is spinal fluid, cerebrospinal fluid, and it all goes down into the spinal cord. It's made in the choroid plexus and is absorbed back into the blood in the arachnoid granulations. So that's important. All right? There is a disease called hydrocephalus, and I'm sure you've heard of it before. The word hydro means water. The word cephalus means brain, water on the brain. If the cerebrospinal fluid is blocked, the spinal fluid cannot circulate, and it results in increased pressure. And this occurs in newborns, and it can compress the blood vessels and crush nervous tissue. The treatment is to drain the spinal fluid by a ventricular shunt, which shunts the spinal fluid into the abdominal cavity. And this is what it looks like. This is typical hydrocephalus. Typical hydrocephalus. Okay? So that is what I want you to know about spinal fluid. and the meninges. But now we're going to talk about peripheral nerves, spinal nerves, and cranial nerves. A nerve. A nerve is a cord-like organ in the peripheral nervous system. It is a bundle of myelinated and non-myelinated axons enclosed by connective tissue. And there are two types, spinal and cranial. And there are certain spinal nerves and certain cranial nerves that you should know, not just for exam number 3, but you should know. Okay? I'm not going to ask you the connective tissue coverings. That's really not important. But I want you to know that most nerves have a mixture of sensory and motor fibers. When you say the word sensory, you say the word afferent. Afferent means that all the impulses from this nerve are going towards the brain and is usually sensory. Efferent, again, is motor. It's all of the impulses going from the brain to an organ, whether it be a muscle or a visceral organ. It is a motor nerve, okay? The majority of nerves are mixed. They have both sensory and motor fibers. So they travel both ways, from and to the central nervous system. Sensory nerves, afferent nerves, only have impulses towards the central nervous system, and motor or efferent nerves only have impulses away from the nervous system. There are many fibers in mixed nerves, and you can see there are 4, and these should be in big, black, bold letters. Somatic, afferent. That means muscle. This means muscle. Sensory, from muscle to brain. Somatic, efferent. Motor, from brain to muscle. Visceral, that means the organs in your body. Afferent, sensory, from organs to brain, and visceral, efferent, motor, from brain to organs. Okay? So those are the 4 really types of fibers that are in all mixed nerves. We're in the peripheral nervous system, a collection of neuron bodies in the peripheral nervous system is known as ganglia. If you were in the central nervous system, a collection of neuron bodies in the central nervous system is known as nuclei. And there are many ganglia in the peripheral nervous system. And no, you don't have to know any of them. Just know what the word ganglia means. Okay? What's important is that nerves do not regenerate. It used to be 100% that they don't regenerate. That is not true anymore. With the advance of medicine, we have learned to help people that have nerve damage. If the damage is severe and close to the neuron body, the entire neuron will die, and there's nothing we can do. If the cell body of the damaged nerve is intact, and the peripheral axon is injured, there is a possibility that we can regenerate a nerve in the peripheral nervous system. However, today, we cannot regenerate that nerve in the central nervous system. So basically, central nervous system fibers never regenerate. The astrocytes, which are the most abundant neuroglia, form scar tissue. And that's why the axons do not regenerate in the central nervous system. In the peripheral nervous system, if the damage is not severe, the nerve can regenerate. The nerve can regenerate. Let's talk about the 12 pairs of cranial nerves that are associated with the brain. I want you to remember that they are paired. There is a right and a left one. So 12 pairs of cranial nerves means there are 24 cranial nerves. Most of them are mixed. 2 pairs are purely sensory, and we'll talk about every single one of them. They're all numbered 1 through 12. You don't have to remember the number. I'm going to ask you a question on some of these cranial nerves. Know the cranial nerve name. Know the cranial nerve name, okay? There are mnemonics on how to remember 1 through 12, and you can look at this and see, how to remember it. Oh, once one takes the anatomy final, very good, vacations are heavenly, and we'll show you what that really means. Okay? But here are the 12 pairs of cranial nerves. Okay? They're numbered from anterior to posterior. So number 1 is the olfactory nerve. Number 2 is the optic nerve, and we'll talk more about the other numbers. Okay? The reason I'm focusing on the optic and the olfactory nerve is because these are the 2 pairs of nerves that are purely sensitive. Number 1, olfactory. Number 2, optic, purely sensory. There is no motor function to either of these nerves. Okay? This is a good chart. It shows up numerous times in this presentation. It shows you the number of the nerve and the name of the nerve. Again, don't worry about the number, worry about the name. I'm going to ask you the name, not the number. Okay? But it's a good review. It tells you that are they sensory, are they motor, or are they mixed? Okay? So that is important. And you can see here that the olfactory nerve and the optic nerve are only sensory. And that is important. That is very important. Here we go. Cranial nerve number 1. It is the nerves that sense smell. That is their function. So where is it? It's in the nose. It's in all of the bones that form the nose. Okay? So that's why you see the ethmoid bone, the cribriform plate. That's where the olfactory nerve is. It is purely sensory, and it is the sense of smell. The optic nerves. The optic nerves are basically arising from your retina. It is really part of your brain. It is a brain tract. It is purely sensory. It is the nerve of sight. It is the nerve of sight. And that's what I want you to know about the optic nerve. Purely sensory and is the nerve of sight. The ocular motor nerves. The ocular motor nerves, nerve number 3, is involved in movement of the eye. Movement of the eye. You don't have to know exactly what it does because it actually moves the eye in 4 directions. It raises your eyelid. It directs your eyeball to focus. It controls the muscle that dilates or constricts your pupil, and that muscle is called the iris, and it controls lens shape. It is a pure motor nerve, ocular motor, number 3, cranial nerve number 3. Cranial nerve number 4, the trochlear nerves. It also is involved in eye movement. It is the primary motor nerve of the eyeball. It actually innervates the superior oblique muscle. It allows you to look up. That's the trochlear nerve, purely motor. The trigeminal nerves, the largest of the cranial nerves. It is a mixed nerve. It is the primary sensory nerve of the face. It has many branches. You don't have to know the branches, but know that cranial nerve number 5, the trigeminal nerve, is the largest of the cranial nerve. And it is the majority of the sensory fibers of the face. And it does have a motor function. It allows you to chew. It allows you to chew. The trigeminal nerves. Remember, they're paired as one right and one left. The abducens, cranial nerve number 6. Cranial nerve number 6 is primarily a motor nerve. It also moves the eye. It allows you to look left and right. Cranial nerve number 6, the abducens nerve. So we've talked about 3 of the cranial nerves that move the eye. One is number 3, the ocular motor. One is number 4, the trochlear. And here we are with number 6, the abducens. All 3 of these cranial nerves move the eye in some fashion. The facial nerve. The facial nerve is the chief motor nerve of the face. It functions to include facial expression. It also has sensory function too. Its sensory function is taste. And if you can remember what my face looks like, I have a paralysis of my left facial nerve. That is known as Bell's palsy. The left side of my face, motor-wise, is paralyzed. I cannot close my eye. I have a droop on my left, around my left lip. Okay, and I've had it for 5 months. Actually, today is the 5th month. My anniversary is today. Hopefully in 30 days, it will go away because it usually takes about 6 months to go away. But remember that the facial nerve is the is the number one motor nerve of the face, and it also has sensory function in taste. Nerve number 8, the vestibulocochlear nerve. It used to be called the auditory nerve because it is involved in hearing. Not only is it involved in hearing, it is also involved in balance. So that's why it's now called the vestibulocochlear nerve, because it basically is involved in equilibrium and hearing. Nerve number 8. Nerves number 9, the glossopharyngeal nerve. The glossopharyngeal nerve innervates the tongue. It is the motor nerve of the tongue. It is also a mixed nerve and is involved in taste. So far you've had 2 nerves involved in taste. Nerve number 7, the facial nerve, and nerve number 9, the glossopharyngeal nerve. The vagus nerve, cranial nerves number 10. This is probably the most important cranial nerve. It is the longest cranial nerve. It is the only cranial nerve that leaves the head and face. It goes into your thoracic and abdominal cavity. 90% of the fibers that make up the vagus nerve are parasympathetic fibers. 90% of the fibers that make up the vagus nerve control the autonomic nervous system. Also, the vagus nerve is involved in taste. So you have 3 nerves of taste: the facial nerve, the glossopharyngeal nerve, and the vagus. The word vagus means wanderer in Latin. It means it leaves the head and neck. The accessory nerves. It used to be called the spinal accessory nerve. Nerve number 11. The importance of the accessory nerves is that it innervates your sternocleidomastoid muscles. It allows you to move your head. It allows you to move your head. It is a motor nerve. It is a motor nerve. And the last is number 12. Number 12 is called the hypoglossal nerve. It is a motor nerve, and it controls speech and swallowing. It innervates the muscles of the tongue that contribute to swallowing and speech. Those are the cranial nerves. And again, this is a great review. This is a great review. Okay? Look at these and see what they do. See what they do. That's important. That's important. You can look here and see that the 3 nerves involved in taste are the facial nerve, the glossopharyngeal nerve, and the vagus. You can also look and see that the oculomotor, the trochlear, and the abducens are involved in eye movement. Eye movement. Okay? So that is important. That is important. Let's go to the spinal nerves. The spinal nerves originate in the spinal cord. So they are branches of the spinal cord. and they are also paired, right and left. So there are 8 pairs of cervical nerves, C1 through C8. There are 12 pairs of thoracic nerves, 5 pairs of lumbar nerves, 5 pairs of sacral nerves, and 1 pair of coccygeal nerves. There are certain nerves that I want you to know, and I will focus on those names. I will focus on those names. Okay? But these are where they come out. They come out. The cervical nerves come out into what's called the cervical plexus. Plexus means a bundle of nerves. We also have cervical nerves that come out in the brachial plexus. The brachial plexus controls the arms. There is also a lumbar plexus in which the lumbar nerves come out, and there is also a sacral plexus where the sacral nerves comes out. And there are certain named nerves that I want you to remember. Don't worry about the roots. That's not important. But basically, just like the cranial nerves, these nerves mostly are mixed nerves. They're either motor nerves or sensory nerves or a combination of the two. Combination of the two. Motor and sensory. And again, motor is efferent and sensory is afferent. Please know those words. All right, let's talk about the nerves themselves. The cervical plexus. The cervical plexus are the cervical nerves. And the one here that is the most important nerve that comes out of the cervical plexus is the phrenic nerve. The phrenic nerve. The phrenic nerve receives its fibers from C3 to C5. It is the major motor and sensory nerve of the diaphragm. Without it, you cannot breathe. If your spinal cord is fractured and broken above C3, this nerve will no longer work, and you will not have your diaphragm to breathe. That means that you must be put on a ventilator to save your life. Okay? This is how hanging kills people. When you hang someone, you break C1 and C2 and C3, and that breaks your spinal cord, and that breaks the innervation of your diaphragm from the phrenic nerve. From the phrenic nerve. So the phrenic nerve is extremely important nerve, spinal nerve. All right? I kind of think I said this already. Here you go. If you break your spinal cord, you no longer breathe. You no longer breathe. If there's irritation of your phrenic nerve, you'll have hiccups because you'll get spasms of your diaphragm. And that's all because of the phrenic nerve. All right? The brachial plexus is also involved in the cervical spinal cord and part of the thoracic spinal cord. And there are nerves that come out of the spinal cord and go into the brachial plexus. And the brachial plexus is your arm, right and left. And these nerves are called axillary, musculocutaneous, radial, medial, and ulna. The only three that I want you to know that come out of the brachial plexus is the radial, medial, and ulna, because these nerves go into the wrist, go into the wrist. So that's what's important about those brachial plexus nerves. Here they are: median, ulna, and radial. And basically, they're all motor nerves. They're all motor nerves. Okay? The reason I'm focusing on the brachial plexus is because if you have an injury to your brachial plexus, you're going to have a hard time using your arm. Injuries that occur in the upper limb, when the upper limb is pulled on, stretches the nerves. Like when a football tackler yanks an arm of a running back, or a blow to the top of the shoulder, or it forces the humerus down, it tears the nerves, and you no longer will have function in that arm. Injury to the median nerve gives you the inability to pick up small objects. The most common injury to the median nerve is at your wrist, and it's called carpal tunnel syndrome. If you continue to do repetitive actions, like you're a typist or a computer expert, or work with your hands, you sew a lot, you are a menial worker, you do a lot of shoveling, the connective tissue in your wrist will get bigger and press on the median nerve. And when it presses on the median nerve, you'll get numbness and tingling in the middle of your hand, because the median nerve has been compromised. And that's known as carpal tunnel syndrome. And the treatment of carpal tunnel syndrome is to have an operation to remove the connective tissue so the median nerve in your wrist will no longer be compressed. If you have trauma to your radial nerve, which is on the outside of your hand, okay, it supplies innervation to your thumb, you will have inability to extend your hand. You won't be able to extend your hand. And this is a very common thing. You go out on a Saturday night and you get drunk and you fall asleep on your arm that's draped over the back of a chair, cutting off the blood supply to your radial nerve. And you wake up and your entire arm is paralyzed. Hopefully, you get your blood supply back. But there are certain times you don't. This is why when we give somebody crutches, we have to make sure they use them properly. Because if you can compress the radial nerve coming out of the brachial plexus underneath your arm, you will have paralysis of your arm. So people should be wearing crutches properly. This is known as Saturday night paralysis. And there it is. You can't lift that arm up. The radial nerve controls extension of your wrist. If you have an injury to your brachial plexus and the radial nerve is compressed, you cannot extend your wrist. It's called a wrist drop. It's called a wrist drop. All right? The lumbar plexus. There is one very important nerve in the lumbar plexus. And the lumbar plexus involves the femoral nerve. Okay? And that supplies innervation to the muscles of the lower leg. So that's an important nerve in the lumbar plexus. More importantly is the sacral plexus. And the biggest, longest, and thickest spinal nerve in your body is the sciatic nerve. It innervates the hamstrings. It innervates the majority of muscles in your lower leg. And if you've ever had back pain and you irritate the sciatic nerve, you will get lightning type of pain down the back of your leg. The sciatic nerve comes out of the sacral plexus and has the distinction of being the largest and thickest nerve in your body, the sciatic nerve. Okay? The rest of these nerves are not important. Sciatic nerve is very important. And there's the word sciatica. Sciatica, a common problem characterized by stabbing pain radiating down your leg. Usually, if it doesn't go away, it's a sign of disc problems in your lower spine and needs to be either operated on or injected. The rest of the spinal nerves are not important except the word dermatome. Dermatome is described as an area of skin innervated by the cutaneous branches of a single nerve. All spinal nerves except C1 participate in dermatomes. This is a map of the spinal dermatomes. Here they are. Why is this important? Because if you lose sensory function from T4, which is your nipple line, down, that means that you have a fracture above T4. If you're in a car accident or you fall out of a building and you have no sensation above your nipple line, that means you have a fracture somewhere above T4. If you are breathing normally, we know that C5 is intact because C5 is the phrenic nerve. So we can map out exactly where your fracture is. Where your fracture is. And in today's world, we do a CAT scan and we prove it. But we can certainly understand why you have no sensation at your nipple line. Okay? So T4 is your nipple line, T10 is your belly button, and these are important dermatomes. Okay? Important dermatomes. I think I've said enough. Let me get out of this.